COVID-19 has Leeds in lockdown. What are things going to be like for those on the front line fighting this? One person who can give some insight is Sherwin from Leeds Beckett.
What I do know in Leeds, they're doing very thorough what they call doffing and donning training, which is training, putting on the suits, putting on the masks, which are very different to the paper masks. They're plastic masks that are fitted directly to your face and you go into a full suit. So the Leeds Trusts are taking the protection of their staff very, very seriously and ensuring that they are all trained, they are all issued with full face visors, and that they do have the protective equipment. But if you think with a patient, these patients who develop the pneumonias, in order to put an airway down somebody's throat, you have to get very, very close to their face to visually see what you're putting down them. And even with a full face visor that comes down your full face, if any spittle goes up under the neck, under the mask, it's really hard to give someone 100% protection when you're working within inches of another patient who's infected's face. And it is going to be an unfortunate reality that our healthcare staff will die of this. Some of them will die despite all the safety measures we put in place, despite all the safety measures they take on for themselves. A minority are going to die. And let's not forget, some of those may have contracted the virus outside of the work environment. They may have contracted the virus from a family member, from going shopping. They may have contracted the virus outside of the work environment.